tuning in today. We have a wonderful session and of panelists today on a very important subject. So today we're going to be talking about separating fact from fiction in school health and safety. A topic that we've actually been running a number of roundtables on for the past few weeks that have been very productive. So we decided to do this larger webinar to actually expand that audience because the roundtables we've been limiting in size. So we know that there's so much conflicting information out there about what upgrades you need to make in order to keep your schools healthy and safe. It's almost be impossible to separate some of the fact from fiction that's out there. So that's what we're doing today. We're bringing together a panel of experts to do exactly just that. During this webcast, we're going to discuss issues around indoor air quality and transmission, HVAC strategies, and new technologies, and what's included in the latest round of stimulus funding that's coming your way. But also a very important topic, which we know is top of mind to a lot, of how to communicate the safety of your buildings to concerned parents and faculty, and planning beyond the pandemic. So the people we brought together today are all thought leaders and experts in there. Instead of me reading their bios, I'm going to ask them to join me on screen one by one to do a little introduction by themselves. So we're going to start first with Paul Scialla, who is the CEO of Delos and founder of the International Wellbuilding Institute. How's it going today, Paul?
Great. How are you, bud?
Great.
Hi, everybody. This is Paul Scialla, founder and CEO of Delos and founder of the International Wellbuilding Institute, which is the world's largest certification platform for healthy buildings, over 1.5 billion square feet in over 80 countries, adhering to our Wellbuilding Standard. We've been merging the health sciences with the building sciences for almost a decade. The first half of that pure research, and then in the ensuing years, we've been focused on things like ultrafine particle filtration for air quality, understanding the size of a pathogen concern, such as the SARS-CoV-2 pathogen concern, and how to effectively solution all of that. So we look forward to speaking with you all today.
Excellent. Thank you, Paul. And now also our next guest is Barbara Spurrier. Barbara is the managing director of the WellLiving Lab. Barbara, are you there?
Hi, everybody.
Yes.
Thank you. So yes, the WellLiving Lab is a collaboration of Delos and Mayo Clinic. We opened almost 5 years ago adjacent to the Mayo Clinic campus in Rochester. We study how indoor health and environments can improve health and well-being. Our lab is about 6,000 square feet, and we can reconfigure our environments. It's currently set up as offices and homes. We have almost 500 sensors in the lab, so we can evaluate temperature and lighting, biometrics, air quality, all kinds of things. Everything we do is supported by the Mayo Clinic research infrastructure. So because we have human subjects in our studies, they all go through what's called the Institutional Review Board. And so that's really helpful that we're able to collaborate with Mayo. All of our studies have a Mayo Clinic physician or physician scientist as a principal investigator. Our team is very multidisciplinary, so we have scientists from the backgrounds of mechanical and behavioral, electrical engineering, behavioral science, neuroscience, cognition, and other fields. This year, like all of us, it was such a pivot to say, with what's going on with the pathogen transmission, what makes sense for the lab. And what we do is we try to answer unanswered questions. So we actually have expanded our lab to, of course, include Mayo Clinic, but Mayo Clinic infectious disease scientists, virologists, molecular medicine specialists, as well as the University of Minnesota. And there we have the Department of Mechanical Engineering and Dr. Chris Hogan, who's also the editor of the International Journal of Aerosol Science. So what we always try to do is say, what does science not know? And having people like Dr. Hogan to say, let's go ahead and validate what the science already tells us and be sure we're using the lab's resources to answer, again, those unanswered questions. So we've been doing, we believe, very important work in air as well as surface. Our scientists have really been geeking out with the kinds of work that's underway. So from the air side, there really is very limited scientific knowledge about what's going on with filtration and ventilation and the transmission of particles. There are a lot of things we do know in terms of the importance of air purification units, and we'll come back to that later, but there are things that we don't know that we're trying to learn. And from the surface side, we've actually had a collaboration going on with 3 labs at Mayo Clinic, where we can actually grow the virus and try to understand what's going on with the virus that's able to reproduce or multiply, and what's important in terms of cleaning surfaces. So this whole thing about, is there over cleaning of surfaces and all kinds of things. So happy to be with you. That's just a little bit about the lab.
Excellent, Barbara. And those are all things we're going to dive into, besides learning how to grow the virus. I don't think we're going to teach the audience how to do that. Thank you. And last but not least, welcome to the screen, John Shea.
Good afternoon, Michael. Nice to be here. Thanks for having me. Good to see you again. I am John Shea. I'm the CEO of the Division of School Facilities for the New York City Department of Education. Department of Ed in New York City is the largest school system in the United States and one of the largest in the world. We serve 1.1 million students in about 1,400 buildings, over 135 million square feet. And we have challenges on any given day, not even considering COVID. About 10% of our student body has a disability, is classified with a disability. About 135,000 of our students are English language learners. We've got our hands full on a regular day, and COVID has just made it a little bit more complicated. New York City is a little bit different than a lot of districts. We have a number of different groups that are involved with the infrastructure. I handle the maintenance and operations, the cleaning and the daily maintenance. We have the School Construction Authority, which does all the capital construction and the major renovations in our buildings. And we have the Division of Space Management, which handles all of the space allocation within the buildings. So it's a great team, and that allowed us to actually stay open pretty much for the entirety of the pandemic so far. We started out last March when this first happened with opening up regional enrichment centers in our buildings for providing in-person instruction and daycare services to the children of our first responders. And then we expanded that into eventually testing sites, and now we're opening vaccination sites. We've always maintained, as my colleagues out there know, school buildings are the centers of their communities in many ways. We're still election sites, and now we're actually open for in-person instruction. Currently, we're open for K-5 and special education and pre-K. And in another couple of weeks, we're going to be opening up our junior and middle schools. So it's been an exciting ride, and I'm happy to be here to talk about some of the things that we've done to get to this point.
Excellent. Thanks for the introduction to all of you. So as I mentioned at the start here, just for the audience, we're going to be talking about, of course, important topic, IAQ, indoor air quality and COVID transmission. We'll get into some of the HVAC, existing buildings versus new buildings. We will talk on cleaning and then the communication piece. And then towards the end, we'll talk about where do we go from here post-pandemic, which we are diving back into, I guess, on the IAQ side. I guess, Barbara, I'd like to go to you first. Within the WellLiving Lab, I know with the partnership with the Mayo Clinic, you've done a significant amount of research into indoor air quality and the viral transmission. Can you tell us about some of that research and, what are you finding?
Absolutely. So we've learned a lot about the importance of secondary units like air purification and how that can work with HVAC systems. But the things that we're studying now, even though we know things about HVAC systems, there's limited knowledge to verify, what's the ideal relating to settings for filtration and ventilation. So the things that we're doing right now to be able to look at how do particles actually spread in indoor spaces. So we're doing things with mannequins, working with our Mayo Respiratory Sciences, cough simulators, where we can actually simulate the distribution of different kinds of particles from a cough machine. So different kinds of things to really try to study what's going on with the spread of particles that go beyond the things we already know.
Great, thank you. Now, Paul, similar within your organization, I know you've been studying this and also studying the technologies and what works. I know a lot of things work, but some things work better than others. Can you share a little bit more kind of a background on how your organization does that and kind of some of the conclusions you've come to? Nope, I don't think we're getting your audio. Hello there?
Sorry about that, guys. Yes.
Oh, you gotcha.
Absolutely. Over 5 years ago, we invested very heavily to open our WellLiving Lab, which Barbara runs with Mayo Clinic. And as a standard-bearing organization, once we introduced the Wellbuilding Standard again about 5 years ago, Delos went further, zooming into specific products, solutions, technologies that are good health interventions for the built environment. We are a product agnostic organization that gets an early, mid-stage, and a late look at basically everything you can imagine under the sun. Every manufacturer, every product, technology, methodology, they come to us. They want our stamp, they want our validation, our research, our vetting. We have been studying very deeply ultrafine particle filtration for almost 5 years. We, again, understand the size of a pathogen concern such as the one we have now, 0.08 to 0.14 microns in size. We can tell you the good, the bad, the ugly with pretty much anything that's been on the market for years. Bipolar ionization and the ozone concerns therein, UV light and the concerns of airflow being way too quick for that to be effective. And then when we do see something we feel is appropriate, we go further, zooming into more research, laboratory device testing, ultimately then aggregating a lot of demand, driving supply chain pricing. And we've in fact been quite busy for the last several months deploying over, 120,000 portable wall-mounted or standalone air filtration units into some of the largest districts in the country. 99.97% effective down to the micron size that matters, 0.007 micron. We get frustrated with the unfortunate position a lot of you folks are in, having to play virologist, epidemiologist, seeing every solution under the sun, folks throwing out words like HEPA and MERV. And, the science tells us that that is not something that is going to be effective on ultrafine particles. You'll get a 0.3 micron rating at best in terms of efficiency. But I would say this for the group, we're a complementary resource first. As a standard-bearing organization, we can return an opinion within an hour on any type of product you're looking at. Clearly, air quality is of utmost importance. Ultrafine particle filtration therein, and the solution we've landed on and have endorsed is starting to scale to a lot of the districts in the country. Very affordable, by the way.
Yeah. So thank you, Paul. So John, you're in the role of having to sift through all that information that's out there. As the head of facilities for the largest school district in the country, how has the conversation around indoor air quality changed since the start of the pandemic, or has it not changed? What's your experience been since the start? And can you tell the audience about things that you've been doing within your district, which I just wrote down? It has 1,400 buildings.
Sure. So the conversation has definitely changed. And again, my colleagues out there know what it's like, particularly in the education facilities business. Deferred maintenance is always an issue. And with regards to HVAC, in a lot of cases, it was the common thinking was working against us. If we think back to the 70s and the 80s, people were more focused on energy conservation and actually reducing airflow through a building in order to save energy. That was what people were most focused on. Now we had a very rapid shift last March from how do we take things that we might not have been prioritizing for repairs, and how do we take things that we might have been purposely not running and getting all of that stuff repaired and back up and running in a very short period of time to make people feel comfortable that ventilation was adequate for safety for people actually coming back for in-person learning. So we did a lot from the very beginning. We had to do a survey of all of our locations and all of the ventilation in each one of our buildings, understanding that every building is different. We have buildings that are over 100 years old. We have buildings that are very new. You have to handle those differently, collecting all of that information, and then putting a plan in place to go and address all of those repairs. And we hear a lot about upgrades, and that's something that we tried to stay away from as the initial part of what we did, because first we had to get back to a state of how are the buildings designed and making sure that we could commit to they were working as the way they were intended. The stuff that Paul talked about, other opportunities for air filtration or UV or some of these other technologies, that's still an ongoing discussion. And that's still interesting to see the way that's developing, and we're learning new stuff every day. Filtration is one of the areas that we focused on, as well as a lot of other districts, but it'll be curious to see what other technologies might be available to us going forward. So
another question, I guess, for you then, John, is, since the start of the pandemic, there was a lot of talk about bipolar ionization, UV, all these different technologies on which is the most effective. how do you sift through the noise and try to, make the right decisions when, especially when you're thinking about for a district as large as New York City, you've got so many other different challenges. It's not, and so much time in the day to kind of really determine what's the best use.
Yeah, sure. So there was a lot of collaboration on that. Certainly, we're building experts, but we're not health experts. We're not technology experts. So first, listening to the CDC guidance that came out was pretty important to us to get a sense of what was happening nationally. Working with my colleagues across the country to see what they were doing was also very helpful. And working with our city and state health departments to see what their thoughts were. Anything that we did, we made sure that we ran it past the local health authorities to say, hey, we think this is a good idea. What do you think from a health perspective? Getting together and then publicly messaging that out. This was not John's idea. This was not the DOE's idea. This was the best thinking of everybody, including the health experts, which are the ones that we really should be listening to say that these technologies are the direction we want to go.
Yeah. So as I acknowledged at the start here, we've been running roundtables, and Paul and Barb have participated in a number of them over the last few weeks and months, actually, with a number of districts, talking about that main topic, about really determining what's the best solutions out there. Paul, I know you could speak to this, from an existing building standpoint, and also from a new building perspective. Where's your research, and obviously Barb's research as well, put us at right now?
We landed on one approach: portable, wall-mounted standalone units, as mentioned, and we've seen this to be a multi-filtration and location solution, which is also highly effective. This science that we have landed on is uncomparable, candidly, with regards to cost, scale, and scientific rigor. So that's a real win, all three of those. So these are the units that we have been helpful and recommended in, and as mentioned, New York City included, a lot of units have been deployed into districts across the country. This is what we feel to be by far and away, hands down, a better solution and approach than anything that we've looked at for 5 years in that regard. Okay,
so on that, I guess then looking then to new construction, new buildings. So the portable units are good there, but what about MERV filters and bipolar ionization and things that people. And I just want to pause for a second here for the audience. If you have any questions, please make sure you drop them into the chat there. We can. You're tuning in live right now. This is your ability to ask questions. If you're watching it on demand, you can't do that. So make sure you ask some questions.
Yeah, I think, portable is probably the wrong way to explain standalone units. These are permanent solutions. These are devices that last 8-10 years and beyond. It's a 1-year annual filter change. But I think when you look at HVAC, induct, inline solutions versus standalone, first and foremost, as John indicated as well, a lot of districts have old buildings. And even trying to get to a MERV 10, 11, or 13 is relatively impossible or highly expensive. And candidly, a MERV 13 is really not going to do the trick on ultrafine particles. There's a lot of inefficiencies with HVAC. Air leakage, velocity leakage, airflow leakage, number one. But here's, I think, the primary point that we've come across in our research and understanding. The closer you can get to people where respiratory droplets are occurring, the more efficient these solutions are going to be. Consider a room where you've got one duct in the front of the classroom, what have you, someone in the back of the room talking, what have you. That air's got to travel a long way to get into the duct, get clean, hopefully without a drop-off in any efficiency, and then get recirculated. Getting closer to the acute point of concern, a standalone unit placed on either side of the room, closer to where people are, where respiratory droplets are occurring. And it's all common sense, candidly, but you are obviously able to capture a lot more of the respiratory droplets in real time and as close as you can get. The type of solution here that we've discussed, you're talking about a MERV 16 or 17 plus type of efficiency rating if you have a comparison with no low drop, because again, you're not in the HVAC or the duct. So this is definitely the most scalable, affordable, and effective solution in our minds.
Right. John, when you hear Paul sharing that, and I know that you, of course, the New York City schools has deployed these units that Paul's referencing, but is that's in combination with other things that you're doing?
Yeah, it sure is. So again, working with the health department and some of our other partners, Schools are actually, you're seeing nationwide the statistics that schools are very safe with regards to COVID transmission. And I think there's a lot of reasons for that. It's a controlled environment for the most part, so that you can make sure people are doing what they need to do. And we look at it in New York City as a multi-level approach. There's a lot of things you need to do to maintain safety in schools. One is wear a mask, of course. Number two is social distancing. We're all familiar with that. Good hand hygiene and continuing to wash your hands and having soap and paper towels in the bathrooms is important. Ventilation is definitely on that list. And whatever we're doing with regards to ventilation, maximizing the airflow through the space is a good thing. Increasing the vent filtration level on our central HVAC systems from MERV 8s to MERV 13s or 14s, it's not going to hurt. We're going to do that. And the filters is definitely a part of that process that we've done. We've ordered 67,000 these purifier units for New York City. And we're right now, it's at least one in every classroom at this point, including 4 middle schools that we're opening in a couple of weeks. That's another layer of protection that seems to have, based on our results and the transmission rate in schools, has been very effective.
Got it. Thank you, John. And I'm looking at just at some of the questions here. Someone's asking, Shell's asking, what is the standalone unit that you're referencing? Paul, your opportunity to explain what that is.
This is the Delos Healthway unit. Again, if we see something, we start to go deeper, aggregating that demand. So the specific unit we can send information on is a Delos powered by Healthway standalone air filtration unit, size of a small fan, plugs into the wall. It's a 40-watt amperage and gets that 99.97% efficiency rate down to ultra fine particle size, 0.007 microns. This is also something that kind of zooms out to a bigger picture here. Pandemic or not, pathogen concern elevated or not, this is obviously a much bigger, decades-old problem. Indoor air quality is 2 to 5 times worse than outdoor air quality basically anywhere in the world. Pollution outside seeks in. There are materials in the buildings, and the direct link between air quality indoors and cognition, mental acuity, performance, test scores. Look, if one good can come out of this, particularly with a lot of that federal money coming, this is finally a very long overdue platform to take a decades forward approach to finally get air quality in classrooms to be conducive to the right learning environments and performance. Not to mention these units effective against mold, PM10, PM2.5, all other toxins and pollutants. So again, it's been a terrible year, and we commend the work all you guys are doing right there, looking to really provide for what's the most essential part of this nation system to get going, getting these kids educated, getting them in classrooms. If one good can come out of this, is the hope that these environments way through a pandemic and way before the next pandemic will be equipped with much better, much more purified air for the students in the classrooms, which again, we know is a decade-old problem to begin with.
Michael, if I could just add a comment.
Yes, of course.
Great. So we've created something called research perspectives, and one is on air purification. One of the things we do is we're always reviewing the literature. And again, we're trying to say, what are the unanswered questions that we can add to that? So we have a piece on air purification that tries to say, based on everything we know, what do we think, are the right kinds of solutions? So just really consistent with what Paul is sharing, John has shared in terms of interventions and such. Be really happy to share that. There's a big study that just came out from Germany, and it was actually looking at air purification strategies, implementation in the school system. It was done by a very reputable scientist with hundreds of publications. And so, again, we're really fortunate to have this editor of the Journal of Aerosol Science who's collaborating with us in the WellLiving Lab, so we know what's going on in the world with research. So I'm happy to share that piece that I think will just add sort of the science and what we know from a number of studies that have already been done.
Yeah, and thank you, Barb. And just so you know, again, in the audience here, we're going to share in the chat. I think someone on our team is going to put a link to that unit, and we'll also be sharing some referencing a report later on and some additional resources for you all to follow up and get some of the latest research from Delos and the WellLiving Lab. So I want to move on to the topic, as John just hit, on is cleaning. We know there's a lot of hygiene theater going on at the moment, and a lot of it is really just to make people feel safe. But at the end of the day, is it necessary, right? We know that COVID is not transmitted by surfaces. At least that's the research I've read. So, Barb, I'd like to go to you on that. I know that you've been doing some research, and I know it's maybe not final, but can you give us a hint on what the conclusion might be?
Well, and so we have some data coming from our studies that will be available very soon. And, not to speak for the scientists, but I think there are some concerns about over cleaning. So what we're doing is we're really studying the ability of 2 different disinfectants to kill the virus that causes COVID-19 on 3 different surfaces. And so the unanswered questions, as I mentioned, which is what we're always drawn to, is while there's prior research about disinfection, most of the research has not used the actual viruses that are capable of replicating or multiplying after landing on surfaces. So when I mentioned our scientists are really geeking out about this is something that has been the coordination of 3 labs at Mayo Clinic with our WellLiving lab. So we're actually using these viruses. We're studying this and determining whether we're properly disinfecting the surfaces and how much disinfection is actually needed. So I think this idea of less over cleaning and how we're allocating resources in the right kind of direction are things that we'll be able to share very soon. So again, we're planning a session for later in February to hear directly from our scientists from Mayo Clinic, University of Minnesota, and our WellLiving lab.
Yeah, John, when you hear, there's a lot of expense going into cleaning, right? And districts that are always, strapped for cash. Do you feel that there's still the optics that are necessary, especially when it comes down to making the faculty and the students feeling safe about coming back in? Have you adjusted the cleaning protocols within New York City schools based on the latest science?
Sure. So first, I'm going to start with a story, and I'm going to date myself a little bit here. I'm a graduate of the United States Merchant Marine Academy. So all those years ago when I was going to college, we as students actually had cleaning duties throughout the building. And the other thing was that if you wanted to use the telephone, you had to go to the phone bank. And we had pay phones where you actually had to put in a quarter and make a phone call. One of the things they taught me 35 years ago was during cold and flu season, you got to go around and with Lysol and a rag and spray those phones, because with everybody using the phones, that's the biggest source of transmission. So this is old stuff. But now the question is, how do we adapt it for the scale of a COVID environment and everybody having to do it in all of our buildings? So to answer your question, yes, we did modify our cleaning procedures. We had a great concern that if everyone came back in person for learning in September and we had 1 million kids in our buildings, what that would look like and the cost that it would be to make sure we cleaned adequately. What's actually happened is with a certain percentage of our students being remote, the occupancy in our buildings is less, and we've been able to adjust our labor to accommodate it and cover what we need to do. We did 2 major things. One was we reallocated some labor to go around during the day and do nothing but do touch point cleaning with a spray bottle with disinfectant and paper towels or rags. And it's what we call confidence cleaning. We're making people feel comfortable. They see a very visible presence in the building that we're going around, we're spraying doorknobs, we're spraying elevator buttons and handrails. It's been effective. It's been effective in practice, and it's been effective in making people feel comfortable that they see people cleaning all day long. And then at night, we do a complete disinfection of all of our buildings. And we have used electrostatic sprayers, which it's not a fogger. It's different than a fogger. An electrostatic sprayer takes the medium and sprays it out in a fine mist, and it sticks to surfaces. And we do every building every night, regardless of whether there was a case of COVID in the building or not. And again, that's made people feel comfortable and been proven effective.
So a question I guess I have for the group here, and again, I know we're going into little segments here, but let's make this a dialogue, is we spend so much time moving with sustainability movement, right? To do green cleaning in California to get rid of plastics. And now here we are with a lot of plexiglass and a lot of additional cleaning, and we're doing it to make people feel comfortable. Is there going to come to a point where we say, hey, look, the science doesn't back this up. We're doing it for maybe not the right reasons, or am I just, maybe getting ahead of myself here?
Barbara, you want to take that?
I think it's a really great question. We're actually looking at, in terms of cleaning products we're using, in terms of green products for sure. On the dividers, I think that's another really important question. We've also put together a research perspective on these physical dividers, plexiglass or otherwise. There are definitely some concerns just in terms of how the aerosolized particles are traveling and what can actually stop them. So again, what we tried to do is review the literature. What do we know and what don't we know in terms of thinking about what makes sense in going forward with intervention. So I think it's a really good question. And I think we're seeing a lot of a rush to go ahead and buy stuff and implement stuff before the science really tells us it's the right thing to do. And,
sure.
And we can understand, but yeah.
And I understand that back, last spring, but now here we are. We have a year of, research behind, and schools are reopening and have reopened. So I guess in short, is plexiglass effective in the classroom beyond the optics? Yes or no?
Well, I'll tell you, in New York City, we don't have plexiglass dividers in the classrooms.
Okay.
We have it in the main offices, and we have it in our school safety desks at the entrances to the schools.
Sure.
But we have not made the decision to put in plexiglass in classrooms with individual students at their desks. Social distancing and wearing masks should be sufficient. It seems to have been.
Mm-hmm. Yeah. Paul, anything you want to add on that?
Yeah, I mean, we get asked this question all the time, and I look forward to our WellLiving Lab publishing findings later this month. I could tell you early intuition is, to Barbara's point, you've got a false confidence issue there. You certainly don't have to be a rocket scientist to understand ultrafine particles can float like dust, and unless that plexiglass is sealing up every single crack and crevice, that's a lot of money on a lot of plastic that may not be doing something as appropriate as what John said, which is the basics: mask wearing, social distancing, and good filtration. And clearly, with the results New York City has seen, knock on wood, and to date, and the great work done there, I think that's quite appropriate.
Yeah, and I'll second that. So, John, as you know, I have 2 young daughters in New York City schools. They are doing remote, but amazing work. With a school district as large as New York, and the politics and everything else to achieve what you guys have with the ups and downs. And the one big piece, though, of course, is the communication. Is communicating with the teachers, the unions, and obviously the parents and faculty as well. Can you share, I guess, some of the work that you've done within the facility, in your role in facilities, and kind of being involved in that, in the communication side?
Sure. So I think it's 2 C words that go together. It's collaboration and it's the communication. And the hardest part, but the most effective part, is the work that you do ahead of time before you actually go back into buildings. Explaining to people what you're going to do, getting their input and making them feel like they have a voice in that, whether that's elected officials, parents, teachers union, all of that. And then when you actually do it, getting that message back out there. There were 2 things that we did that I think were very effective. One was, I mentioned earlier, we did a ventilation survey of all of our spaces, and we took that information and actually distilled the data and put it online on the New York City schools website, so that parents could log on and see down to their students' classroom what the ventilation condition was at the time of the survey. Subsequently, if it has been repaired, and now we are about to start our next round of surveys, and we'll be doing that a couple of times a year to update that information. Because of course, once you run the equipment, something's going to break every day. That's what we do. That's what we get paid for. So to give people a sense of comfort that we're on top of this, we're continuing to monitor this. Custodians are surveying their buildings daily for ventilation issues and reporting them up. And we want to make sure people know that and can see that and can feel it. The other thing that we did was, in collaboration with the teachers union, both the DOE and the UFT created their own videos. The UFT created one for teachers. We created one for parents to physically show. We took our health and safety people, went out into the buildings, showed them sample systems in an old building that just has windows and exhaust fans, in a brand new building that has a sophisticated central HVAC system with building controls, how those systems operate. Actually opened the doors and said, these are the filters. This is a MERV 13 filter, and explained to people how ventilation works. The UFT video was great. They had their folks going around with anemometers and indoor air quality monitors to take CO2 readings in classrooms that were occupied to show CO2 levels, which is an indicator of ventilation, showing the air filters that are in the room. All those things, people could look at it and said, wow, it made it very real to them that it was actually happening, and made them feel comfortable about sending their kids back.
So, but how do you do that when you have 1,400 schools, right? If you show one, how do you convince the parents that their school is actually, safe? I know that that's not an easy task. Is what I'm saying. And I know that I'm not expecting you to have the answers for that. But it's, I guess it's just constant communication. And are you, I guess, empowering or putting the principals and other, each school to kind of demonstrate specifically what they're doing in each school?
Absolutely. And I'll tell you, a good majority of my time over the summer and into the fall was, and it's great that this technology that we're using today was actually able to help us multiply that message. In the old days, I would have to go to a school and I'd have 100 parents in an auditorium and I would reach 100 parents. I was on meetings this summer with thousands of parents who logged on and were able to listen to the things that we were trying to communicate. And you're right, it was principals, it was elected officials, it was executive superintendents, it was health officials. And we would all get on and people would ask questions in the chat, and depending on whose answer it was, they would be able to answer them. And I think we were able to broadcast that technology was a big part of it.
Yeah. So getting back into facilities and air quality and other things, it's also when you say, hey, we've got MERV 13, we've got MERV 14 filters, that's, or HEPA, whatever you're saying, it's another language to most people that don't understand buildings, right? So I would imagine that even having the portable units in the classroom is something that the teachers can see, and obviously parents as well. That has to be helpful there too. And I guess, going back to, the cleaning things too, is that people want to be able to see the things that you're doing as opposed to just, saying that you're doing them as well. Barb, Paul, anything you'd like to add on that? Barbara?
I just
spot on. Go ahead, Barbara. Go ahead.
Oh, sorry. I was just going to add that, it's interesting because the National Institute of Health actually talked about this, and they said that, with physical barriers, they might negatively impact other things that are really important, such as adherence to strategies like physical distancing. So they talked about that barriers can absolutely provide a false sense of security, leading people to believe that it's safe to remain in close proximity to other people. So I think this whole thing about, the visuals and the things that we're trying to do, thinking that it's making an impact, but unintended consequences of things, especially with concerns about physical barriers and what's happening with, droplets that can remain airborne for hours. So again, we have another piece on this one, a research perspective on physical distancing that I'm happy to share.
Wonderful. Yeah, and it just says, not even talking schools, just for me, like if I go into a restaurant, I'm not comfortable being inside just yet, I'll be honest. I'd rather see, unless I know the owner and I know that, they have the proper setup. And that's, coming down to the communication piece. And Paul, I know, with Well, you have the Well Health Safety Rating. So can you share with the audience a little bit about that? And then we can actually show the commercial, the PSA that you've been running about the Well Health Safety Rating.
Yeah, happy to do so. And just to address your previous point, I think John nailed it with regards to communication, transparency, continuous communication, and science, and leaning on science. That's what gets people comfortable, giving them an understanding of why decisions are made. If certain solutions happen to be, in this particular case, also the most affordable, that's great. But really leaning on the science and the efficacy and the process, and I think, New York City's done a wonderful job with regards to making sure all the constituents are informed and have been informed along the way. I remember when I first heard of and saw the ventilation study, and it came up often and constant, and publishing the data and the metrics, and then the communication of the unit purchases themselves. For instance, the standalone units that they purchased, the Delos units. I mean, that got a lot of good, positive, evidence-based driven press, which gives confidence to people. Along those lines, communication across the board is, again, something that's going to be very important, not just now, but in the forward months and the coming years. As you mentioned, the Well Health Safety Rating is a program through our International Wellbuilding Institute, which is a great complement to the physical kind of the upgrades in terms of various hardware solutions, what have you. But there's also a way to govern and third-party verify policy, effective policy. Again, with over a decade of merging the health and the building sciences and the world's leading standard in the world for healthy buildings, the Wellbuilding Standard. Earlier this year, we were asked to serve a role to take existing criteria of the Well Standard and pull them forward to create the newly designated Well Health Safety Rating, which is a seal on the front entrance of any kind of facility after a third-party verification of good practice, health services, stakeholder engagement, continuity programming and planning, air and water quality management, cleaning protocols and frequency therein. The Well seal is scaling quite quickly. You will start to see this seal on the front of supermarkets, grocery stores, schools, movie theaters. Yankee Stadium in New York was the first stadium to achieve it. The Empire State Building, an iconic building. But we're now seeing tens and tens and tens of thousands of buildings across the world, restaurants, hotels, school systems alike, go through the health safety rating, document review as that third-party verification of policy. And again, that comes down to communication. What does that confidence symbol mean? What does a visible air purifier in a room mean? What does a visible seal on a front door mean and signify? And that's why we embarked on this public service announcement type of approach to take people of reach and influence and combine them with people of credibility and science to put forth a message with regards to look for that Well seal. And that's the campaign that's been going out, and it's been great to see the reaction to something that is good. Finally, there's third-party verification of good practice, and that's what that campaign is all about. So again, combining those folks that can reach hundreds of millions of people with a press of a button, with those folks of credibility in science, such as Dr. Stacy Reza, Chief of Staff, Head of Mayo Clinic Staff, Richard Carmona, 17th Surgeon General of the United States, and over 500 virologists, public health experts, and behavioral scientists who've been behind this entire campaign.
Yeah, well, we can show it now.
Yeah.
Bring it up so the audience, if you haven't already seen it,
If you want to get back to your favorite places and feel confident they have put your health and safety first,
look for the Well Health Safety Seal.
Look for the Well Health Safety Seal.
Look for the Well Health Safety Seal.
I'm Dr. Richard Carmona, the 17th Surgeon General of the United States of America. This is the Well Health Safety Seal from the International Wellbuilding Institute, the global authority on healthy buildings.
The Well Health Safety Rating was informed by years of research and input from hundreds of leading virologists, public health experts, epidemiologists, and building professionals around the world.
You'll see it at schools, offices, banks, childcare centers, all the places we go.
The Well Health Safety Seal means that we'll feel better going into restaurants,
theaters, stores, hotels,
stadiums, and all the places that we love.
Everything may look the same, but the Well Health Safety Seal means that your health and safety are top of mind when it comes to
cleaning and sanitizing procedures,
air and water quality management,
emergency preparedness programs,
and health services.
So look for the Well Health Safety Seal outside
and feel more confident going inside. Learn more about the Well Health Safety Rating at wellhealthsafety.com.
You couldn't get Tom Brady for that?
Honestly, folks should get behind this. It's important, obviously, but yeah.
No, it's amazing. It's amazing, and it's great. And obviously, we know it's going to bring visibility to Well, which you already had, and the Well Health Safety Rating. And I guess, just for the audience, can you just share a little bit more about the Wellbuilding Standard?
Yeah, so the Wellbuilding Standard, that process began 8 years ago, as we recognized there needs to be governance in place for healthy buildings as it pertains to people, not just environmental practices with the green building movement, but complementing that with a well building movement. We are all spending over 90% of our lives indoors. Our homes, our offices, our schools, what have you. And so an evidence-based approach on the elements that surround us and how they impact our health outcomes is and has been the foundation of the well building movement and the well building standard.
Excellent, thank you. So I just want to go, we have a question from the audience. And again, for the audience, if you have any questions or comments or anything, throw it in there and we'll bring it up. So one was that, many districts in California, this is going back to something we talked a little about earlier, are going with UV technology and or ionization devices. What are your thoughts on this technology? So I guess throwing that back to you, Paul.
Yeah, guys, again, our scientists have been looking at this for 5 years. Here's the quick and dirty on bipolar, okay? Folks will say, and the product does not kick off ozone. And in some cases, that's actually true. It's the methodology that is of concern. Splitting molecules in the air, okay? The atmospheric conditions of any particular space at any particular time of day, the amount of sunlight coming in, the temperature, the humidity, all of these factors will contribute to how much ozone is actually kicked off. And we cannot stand behind that. And we think we're years and years away from any type of clarity as to that unfortunate kind of unknown. We do know that the work we've done, there are harmful levels of ozone produced by splitting molecules in the air. That's just that's scientific fact. So that is not something that we've ever touched upon or even come close to endorsing. As far as the UV, again, every product we've studied, every technology, it all comes to the same conclusion, that the air velocity is way too quick for that UV light to be effective. So again, we will say this very directly. Those are not categorical so elements of solution that we can get behind at all.
Okay, thank you for answering the question. And then there was one more question asking, can people get well AP credits for tuning into this today? I don't know about that one.
Credits. We're going to look into that very quickly for you. Please email us directly. We've got about 17,000 well-accredited professionals now in 90 countries. So love seeing the movement grow.
Yeah, that's great. So, we're coming up on time here, and, I want to talk about moving forward, moving beyond the pandemic, which I think we can all get excited about. So before we get into the buildings, John, what is something that you're looking forward to doing once the pandemic's over? Nothing related to business. What's the
So for people who know me, they know I'm a big Disney World freak, and my trip in April got canceled. So I'm going to pull the Tom Brady, and I'm going to go to Disney World.
There you go.
Nice. Barb, what about yourself?
Well, I'm thinking about work because for us, the way that we work and the innovation, it's the intersection of all the disciplines coming together, and we miss that so much. So bringing our Mayo Clinic physicians and scientists and our WellLiving Lab team and all the ways that we can connect together in physical spaces, really, really miss that. So super excited to bring that back together.
Oh, nice. And Paul, what about you?
It's been 10 months. We've had 180 amazing employees and professionals working nonstop, 17, 18-hour days, candidly, 7 days a week, because as you can imagine, the world got shocked here. And ultimately, one very simple thing became apparent, that what surrounds us matters. What we touch matters, what we breathe matters, how we gather indoors matters. Pandemic or not, these influences matter, and the fundamental science of people and what surrounds them is what this platform's been about for years, and we've answered a calling. So I look forward to being able to see them in person and actually collaborate in person. But it's been a heck of a 10 months trying to play our role on the solutioning side of this.
I was expecting I want to be on the beach in Mexico or something like that, but those are
come right now.
Honorable answers there. But moving on to the serious thing of where do we go from here in terms of the ensuring that each student has the healthiest environment to learn in a classroom. I know that there's a number of folks that are part of the International Wellbuilding Institute that came from the U.S. Green Building Council. And the CEO of the International Wellbuilding Institute, Rachel, basically came from the Center for Green Schools, right? So she was the director for the Center for Green Schools and did amazing work, really, ensuring the sustainability of schools. So moving forward to making sure that we have, the best air quality, the best water, access to the outdoors and natural light, is something I think that everybody can get behind. It's not a political thing. So, but when it comes down to it, a lot of districts are going to be strapped for cash, over the next 5-10 years as a result of the pandemic. So how do we go just beyond this here now? John, when you think about looking to the future to really kind of upgrade schools, where do you see? Do you see any low-hanging fruit? And do you see things that you aspire to do for your district moving forward?
I think the most interesting thing for us is that having empty buildings for as long as we have, or predominantly empty, and having been accomplished a lot of the backup and deferred maintenance work that we had not done for quite some time, and getting to a point now where we think everything is in a pretty good state of repair, it should be easier to go forward to maintain that. And I think that's our first challenge, is to set up systems and processes and put them in place to make sure that all the good work that we've done hasn't been lost, and we continue to maintain that going forward. And then roll with the punches once we see what September looks like, because right now it's already time to start planning for September and what it is that it's going to be, and what else we're going to have to do a little differently this summer, and take that going forward. Low-hanging fruit, as my colleagues out there know, the day-to-day stuff is really the toughest part of our job, is to make sure that everything stays maintained well, and buildings operate the way that they're supposed to operate.
Yeah. Paul, what do you see as your vision for the next 10 years in schools, going beyond just COVID?
Yeah, we're excited to use the WellLiving Lab platform to ultimately put together the single largest study ever conducted on education with regards to, let's say 250,000 of classrooms with these particular air filtration units, and being able to do pre and post and look at historical data on test scores and attendance. And this is going to get exciting to at least prove longer term what air quality in schools, just the fundamental basic of what we breathe, taking 16,000 breaths a day and making sure that that's clean, and what that can do for reduced asthma rates, reduced absenteeism, upping the ante on test scores and performance and mental acuity. So that's a really interesting foundation we're looking for over the next several years, using units like this, installed units as a baseline, making use of our WellLiving Lab research platform to really do the right work.
Okay. And Barbara, anything you want to add on there?
Yeah, so I would absolutely, just, building on Paul's point, we were dreaming in the very beginning of being able to do research beyond the walls of the WellLiving Lab, and we can do that now. So we have something called a mobile laboratory. We've been building that just with some incredible technicians, technology staff from Mayo Clinic, from Delos, a lot of collaboration using the Microsoft Azure platform. So the idea of being able to go into the field, going into the classroom, and partnering and getting closer to people. So we can bring our human subjects into the lab, but we can get to a much bigger N, much bigger number in this next phase of our research. So I'm really, really excited about that. And I would say this past year, as challenging as it's been, our scientists would say that the pace has been, and I know we're all using the word unprecedented a lot, but really unprecedented in terms of the kinds of partnerships and collaborations and how quickly we've been going with research. So I'm so excited about the new kinds of approaches to research and building out these partnerships, and the idea of going together with the school system into the field in another kind of partnership model.
Yeah. Well, wonderful. I know we're coming up on the hour here, and I think everybody that's tuning in probably has to hop into another video call. So, maybe give them, don't want to go over here. So I want to thank you all for participating today. John, thank you for the work that you do in New York City schools, and for keeping my kids safe when they do get back into class, because they're remote right now. And Barb, for the research that you do, and Paul, obviously, for the work that you do with the International Wellbuilding Institute in Delos. Thank you for joining us today. I know that there's some additional, I'm just looking at the chat one last time. I know there's some questions. People are asking about bipolar ionization and other things, but I know some people from Delos are in there actually feeding them some information direct. So thank you all for joining. Thank you for Delos for sponsoring this series here. And I just want to also bring up on the screen that Delos has a white paper now, a 61-page white paper that's just published on healthy learning environments, which has a lot of the information that was talked about today. So if you signed up for this webinar, we'll be sending this out for you shortly. There's a lot of great information in there for you all to see. So thank you for tuning in today. And we'll be back probably in a few more weeks with some additional content for you. So thanks for your support and have a great day.
Thanks, Michael.
Thanks, Michael. Appreciate it.
Thank you, Michael.
Thank you.